Hello everyone, I am urologist Omar Erdamakaya. Today I will talk about testosterone in athletes. I see a lot of questions about this topic. People who do sports also apply to me online due to testosterone deficiency. Friends, now under normal conditions, there is no universal average testosterone level, there is no agreed testosterone level. There are levels set as lower limits. These are not very sharp limits either. The European Urological Association has accepted 350 nanograms per deciliter and the American Urological Association has accepted 300 nanograms per deciliter as lower limits. In other words, if the patient has hypogonadal complaints such as loss of sex drive, erectile dysfunction or decreased motivation, and if it is below this lower limit, then the person will benefit from testosterone therapy. Along with these complaints, laboratory values should also be low. The situation is a little different in athletes. Testosterone is very valuable and very important in athletes. It is very effective in muscle development and sports performance. The World Doping Committee says that athletes cannot use testosterone. It says that they cannot take such anabolic substances from outside. But on the other hand, we see that testosterone decreases in athletes who have been doing sports for years. Especially athletes who do sports such as wrestling, marathon, or athletes who need to restrict weight. In fact, it is not possible to distinguish whether this drop in testosterone is physiological or pathological. As you can see in the table here, when you do sports for 3 hours 6 days a week for a long time, what is expected is a decrease in testosterone. Two situations arise here. One is a physiological situation, as you can see on the right in the table. Or a pathological situation arises. Your testosterone decreases and hypogonal complaints occur. Also, your sports performance decreases. There is a reluctance to sports and a decrease in your performance. Years ago they called it exercise hypogonadism in men who do sports. They said it could be physiologic or pathologic. One of the questions I get a lot is, I do sports, my testosterone drops. At the same time, I have loss of sex drive and erectile dysfunction. What should I do? Friends, if your testosterone level is low, testosterone replacement therapy can be done in consultation with a doctor. If your testosterone is below 300, if you have complaints, if you want to do sports, it can be done. But it is different if your body has adapted to it. I have had many people who came to me with a value below 300. The person has values around 200 and this person has been doing active sports for years but has no problems. For example, a patient came with a value of 1.71. The patient has no problem with sports. He is also very satisfied with his life. That person had no erection problem, only loss of sex drive due to finasteride use. But as a result, the person has adapted, he has no problem in sports performance, he has no erection problem. He is also satisfied with his life. So as I said, testosterone replacement therapy depends on the condition of the person. What is our goal in testosterone replacement therapy? To bring the patient's testosterone to the optimal level. To take it to the most appropriate physiological levels. Our goal in testosterone replacement therapy is to keep testosterone between 600 to 900 values. So what can the athlete do as the World Doping Committee does not allow the use of testosterone? Then the coaches come into play. This already happens most often in overtraining. Or it is caused by a lack of calorie intake. Because the person spends a lot of calories in sports and should also lose weight, but the calories he takes in do not meet the calories he gives out. Then testosterone drops. Cortisol levels increase. Cortisol also disrupts the hypogonadal axis. When the hypogonadal axis is disrupted, the testosterone level drops again. This is already very obvious in women. When women engage in excessive sports, they may stop menstruating. What is the reason for the menstrual cessation? With the disruption of the hypogonadal axis, the amount of sexual hormones such as FSH and LH decreases in the blood and the functioning of the reproductive system is disrupted. The same situation can also occur in men. But as we said, going back to the beginning, the drop in testosterone in sports can be physiological, that is, it can be a normal adaptation process. Or it can be pathological. The distinction of being pathological is that they have set criteria here. What are these criteria? There will be no weight loss. There will be no lack of motivation. They can accept a drop in testosterone of 25 to 50% as normal if there is adaptation. This is a very serious drop when we look at it. An athlete engaged in high-volume conditioning sports may have testosterone levels of 200 or 250. As I said, it may be normal to have low testosterone levels in athletes who have been doing conditioning sports for years or doing a sport that needs to lose weight. What you can understand from all this is that if there are pathological complaints, there may be a pathological problem. We are also asked if there is a testosterone-boosting supplement. We have launched a supplement product for this. It contains all kinds of herbs and minerals except ashwagandha and tongkat ali. I will add the link below, those who are interested can access it. But do not forget that if there are problems with sleep patterns, nutrition, stress factors, hoping for help from supplements would be waiting for a miracle. In order to increase testosterone, one should first organize his lifestyle, quit bad habits, pay attention to diet and sleep quality. After these, the person can use supplements if they wish. This is the testosterone level in athletes in a nutshell. Thank you for listening, best regards.